Hello, I'm here with Charles Johnson. This is my husband. I'm Kennedy Johnson, and today we're going to be talking to you about the Copay Fairness Act, which is House Bill 315 slash House Bill 141 in the state of Ohio. So about the bill, it was signed into law and effective as of April 2025. This legislation prohibits health insurers from charging a higher copay for occupational therapy, physical therapy, and chiropractic services than the copay required for a primary care visit. This removes financial burdens for Ohioans seeking proven, cost-effective therapy services over prescription drugs. So, my question for you, Charles, is what do you think about this bill and how do you think it can help Ohioans?
I think that this bill will help people who can't really afford to pay everything out of pocket.
Yeah.
And that it will help keep people from needing prescription drugs.
Yeah. So, I think living in Ohio, we're known to be a state where the cost of living is fairly low. That's changed a lot after COVID. We saw a huge increase in people moving here, especially from like Chicago, Philadelphia, New York. A lot of those East Coast cities kind of drove the prices up here. And that's all over the U.S., but specifically in Ohio, that was really damaging for a lot of people because we see how drastic, how small changes in inflation in our goods and products, so that could be for prescriptions or just being able to purchase healthy food can have an impact on Ohioans in general. But I think being able to afford quality health care in Ohio can be a little tricky. It's kind of a slippery slope because Ohio is very redlined. We know this from like just our upbringing in Ohio, but if you live on a certain part of town, you're going to get very low quality health care. You may get providers that just don't seem to care, versus if you go to another side of town where there's healthier food, more natural resources, you get quality care, but it comes with a price. So what do you think, why do you think being able to go to occupational therapy is more important than taking a prescription drug?
Just because of the long-term effects, you can build that muscle stamina rather than relying on a pill that may not work for you in the long term, and it'll save you a lot of money as well. Not having to do all those refills, and as you get older, your body starts to deteriorate, so staying active and keeping your body moving is really great for longevity.
Yeah, I agree. As we get older, it's harder to move our bodies. So if we can start, maybe if we encounter a severe injury, or if we can change our habits following the diagnosis of a condition, that can definitely determine someone's longevity and their process in aging. I definitely didn't realize that before getting into OT school, like how much we rely on prescription drugs. People always say that like the CVS line is longer than the grocery line sometimes, and that's true. Like if you ever seen the line wrapped around the building for a CVS pharmacy, which is our pharmacies here, it's nuts. So I think promoting therapy in Ohio is really important because Ohioans tend to live a very sedentary life. It's cold here 6+ months out of the year. So being able to get up and move our bodies can be a little bit challenging with like seasonal depression. So yeah, we want to promote a healthy lifestyle, and I think you can absolutely do that through therapy, just by giving people more information, tell them things that they may not have known prior to their diagnosis. Can promote a healthy lifestyle and healthy living. So yeah, I think getting away from using prescription medicine, that's a big one. So in Ohio, we have a certain demographic of people that tend to be more affected by higher healthcare costs. So can you tell me more about that? Okay, so you were telling me about demographics. So what demographics are usually affected by high healthcare costs in Ohio?
Usually Hispanics and African Americans tend to be in lower poverty areas, so their income isn't exactly sufficient enough for high pricing and paying everything out of pocket. So yeah, that can make it very tough.
Yeah. A lot of times here, especially in Columbus, people of color make up like our service industry. A lot of them have like food trucks, and living on a limited income can impact someone's ability to go to therapy or even be able to get a prescription for themselves. I would much rather someone be able to afford therapy, because I feel like overall that provides more longevity, kind of like what we talked about before, versus if someone's not able to afford therapy services, them just taking a pain pill every time something hurts, that's just not going to be beneficial. Another thing that I wanted to talk about and kind of get into with you is, why is prescription pain medication, why can that be so detrimental to Ohioans?
Definitely could lead into some kind of dependency on the prescription that you're taking, especially if it has any kind of addicting qualities to it. Could see to a lot of potential of abuse with prescription drugs, especially here in this area. So yeah, that could be a really bad take from that.
Yeah. In Ohio, we had a very bad opioid crisis. People were using heroin at alarming rates. And to know that now legislators in Ohio know the importance of occupational therapy, physical therapy, any type of therapeutic service, to know that they know that is so crucial, because I feel like we're changing lives just by them knowing that we're available to help them versus giving them a pain pill. That's life-changing in itself, because we can pull people away, like you said, from using drugs, and using gateway drugs that could lead to even worser things, to getting therapy services that could change their entire life. So I agree with that. Going back to conditions about how occupational therapy can help, I think if we could promote a healthier lifestyle, we could also help with reducing the rates for heart disease, type 2 diabetes, stroke, obesity, things that can affect you in the long run if you're living a sedentary life. So, last and final question, what do you know about occupational therapy, and how can you promote the use of occupational therapy in your community?
I think it can be used for everyday life. It helps out with things that you normally don't think about, like putting on your shirt, um, getting to work, doing your task at work, um, like just simple things like brushing your teeth, standing up, walking, just things of that nature. Being able to do the everyday little tasks of life that most of us take for granted. So
Yeah, I like that answer. That's exact. So, occupational therapy does do those things. So the things that we have to do, but also things that we like to do. We like to have hobbies and have leisure activities and travel, and we can help in those aspects as well. So, yeah, overall, occupational therapy is vital to, I think, human beings, especially as we age and just go through different phases of life. Occupational therapy can be beneficial at any stage of life, which I think is really beautiful about the profession. So yeah, everyone promote occupational therapy. Are you going to promote occupational therapy at your job if people need me?
yes.
Okay, good answer. Thank you so much for joining us. This is the end of our discussion, and we'll see you next time. Bye.